Hello, everyone. I'm Dr. Katia Batista, a specialist psychiatrist, and today I want to talk about a very important topic that affects both people who suffer from mental illness and our communities in general, the stigma. The stigma surrounding mental health. In countries like Namibia, where many myths and prejudices still exist, stigma can be one of the biggest barriers preventing people from seeking help and receiving the support they need. Through this video, I will explore what stigma is, how it affects individuals, and what we can all do and work together to combat it. Then, what is a stigma? A stigma, in simple terms, is the disrespect or discrimination someone experiences due to a characteristic or condition that is seen as negative or different by society. In the case of mental illnesses, stigma occurs when people feel ashamed or scared to talk about their mental health or seek treatment because of the negative perception others might have. The stigma can take many forms, from disparaging remarks, negative attitudes, to avoiding contact with someone who is perceived as different or problematic. And worst of all, stigma even can be internalized by the persons affected, making them feel that their pain is not legitimate or they don't deserve help. The impact of stigma on mental health is devastating. Stigma has devastating consequences for individuals suffering from mental illnesses. Not only does it create barriers to seeking treatment, but it also contributes to a greater emotional distress and isolation. People with mental health conditions may feel rejected or misunderstood, which worsens their well-being and can even lead to more severe symptoms. A recent study showed that people who face stigma due to their mental illness are less likely to seek mental health or any medical help, follow appropriate treatment, and share their experiences with others. This cycle perpetuates sufferings and reinforces false beliefs about mental illnesses. Just for better understanding, let me tell you real life examples of stigma. Imagine this. You fall and break your arm. This pain is sharp, but you would not think twice about heading to the nearest clinic, right? Now picture feeling an equal sharp but invisible pain. This sadness that won't lift, thoughts that scare you, and hesitating because you are afraid someone may call you crazy or weak or unreliable. That hesitation, that inner voice telling people to keep quiet, is what we call stigma. Let's imagine someone suffering from depression. Instead of seeking help, this person feels ashamed to admit that they are struggling. Their friends or family may say things like, you just need to think positive, or there is nothing to worry about. These responses, although well-meaning, perpetuate a stigma by minimizing the person's real experience and emotions and pushing them to not talk about their issue. Another example could be a person with social anxiety. Maybe they avoid social events for fear of being judged. Often people with anxiety are labeled as shy or weird, which reinforces their insecurity and fear. A stigma does not always come from outside the world. Sometimes it begins at home. For many individuals living with mental illness, one of the most painful realities is feeling excluded or devalued within their own families. In some households, when the member is diagnosed with a psychiatric condition, their opinions and decisions begin to be subtly or even openly questioned. They may no longer be included in important family conversations, their views may be ignored, and their abilities underestimated, not because of what they can or cannot do, but because of the label they now carry. Imagine a person with schizophrenia or a bipolar disorder who, despite being stable and under treatment, is not consulted in decisions that involve family finances or planning, or a young adult with depression whose feelings are constantly minimized, told they are too sensitive or just going through a lot or you are going through a phase. This experience chips away at a person's self-worth is a reinforcement of isolation and helplessness. Even well-meaning family members may unintentionally contribute to stigma. Overprotectiveness, excessive doubt, or fear of judgment from family members, friends, and neighbors can lead to the patient being treated as less capable, less trustworthy, or less normal. This can deeply affect their confidence, independence, and recovery process. What psychiatry patients need most is compassion, respect, and inclusion. Being part of decisions, being truly listening to, and being treated with dignity helps to rebuild their identity beyond the illness. It tells them you are still valued, you still matter. Let's remember that recovery doesn't happen in isolation. Families play a powerful role, not just in treatment adherence, but in emotional healing. Breaking the stigma at home is one of the most meaningful steps we can take toward real mental health inclusion. How to combat then stigma? Fighting stigma requires a collective effort and a change in how we view mental illnesses. Here are a few ways we can start breaking down this stigma. First, education and awareness. The first step is to educate ourselves and others, talking openly about mental health, challenging myths, and providing fact-based information is key to reducing stigma. The more we talk about it, the more it will become normal to understand that mental illnesses are just as real as any other physical illness. Second, support and empathy. Offering emotional support to those suffering from mental health conditions is essential. Practicing empathy, listening without judgment, and offering words of encouragement can make a huge difference. Instead of saying, just shut up, it's better to say, I'm here for you. I support you in whatever you need. Third, let's talk openly about mental health. While conversations about mental health may be uncomfortable, we must have them. People who are suffering from mental health conditions need to know that they are not alone. If you have a personal experience with mental health, share it. Sharing your story can help others feel more comfortable seeking help. The fourth one, challenging stereotypes. Mental health stigma is often tied to false stereotypes. It's commonly believed that people with mental illnesses are violent, incapable of working, or simply weak. These stereotypes must be challenged by highlighting that people with mental health conditions can live a normal life just like anyone else. What you can do as an individual is you are someone who faces stigma. Here are some things you can do. Talk about your experience. Don't be afraid to share your story with friends and family. This can open doors for support and understanding. Communication is key. Seek help. Don't let others' misconceptions stop you. If you need help, seek a professional help. Mental health is just as important as physical health. Self-care practices like meditation, exercises, seeking activities that make you feel good are effective ways to strengthen your mental health. In summary, the stigma surrounding mental health is a barrier that we need to break down in order to create a more compassionate and understanding society. Each one of us has the power to make a change, whether by educating ourselves, offering support, or simply being kind to those who are facing mental health challenges. If you are dealing with a stigma or suffering from a mental health condition, remember you are not alone. You are not alone. There is support, there is treatment, and you can live a fulfilling life. Together, we can create a culture of empathy and understanding. If this video resonated with you, I encourage you to share it, to continue spreading awareness about mental health and breaking down stigma. Remember, your mental health is important. Let's take care of each other. Please subscribe and like this video. Thank you.